In a bid to shore up investments and lift the economy, which is reeling from the lockdown instituted in the wake of the COVID-19 crisis, the Department for Promotion of Industry and Internal Trade is proposing a three-pronged strategy. Sources say these include a mix of incentives and industrial reforms to attract capital investments. CNBC-TV18's Bhan joins us now with the details. Ritu, what is this three-pronged strategy and how receptive will the government be to these ideas?
First strategy, according to my sources, is to create an empowered group of secretaries to formulate investment incentives. Second is to create a set of project development cells where investable projects will be designed, and third will be to create an industrial cluster upgradation scheme. Now, empowered group of secretaries, the primary task will be to focus on 8 specific sectors, which includes network products, basically electronic products, medical devices, pharma, auto, textiles, man-made fiber, food processing, and capital goods, where incentives will be designed for these 8 specific sectors. But that's not the only thing that this committee will do. It will also look at sector-specific and geography-specific incentives, specific FDI-related interventions, as well as hand-holding of specific industrial projects, which will be then directed to specific land parcels available across the country. So this is what the empowered group of secretaries will do. The proposal is that there will be a set of 5 secretaries, including secretaries from DPIIT, Commerce, Revenue, etc., and this will be headed by either the Cabinet Secretary or the CEO of Niti Aayog. The second is regarding a project development cell, where in specific ministries like heavy industries, textiles, chemicals, commerce, there will be joint secretaries who will be implemented, and they will have and design proposals which are known as investable investment projects. Land as well as other government permissions will be taken, and then these projects will be pitched to foreign investors. This will be the primary objective of the project development cells, which will be housed in ministries which will be identified. The third is to have an industrial cluster upgradation scheme through which all industrial parks across the country will have a plug-and-play sort of an infrastructure, apart from core infrastructure like water and waste management, warehousing, etc. This scheme will also focus on issues like housing for the workforce, as well as healthcare facilities for the workforce in that specific industrial park. So this is a three-pronged strategy which is being worked out as of now. It's at an advanced stage of interministerial consultation. With that, it's back to you.
Ritu, many thanks for joining us to take us through that. To discuss the government's plan, I'm joined by Ramesh Abhishek, the former secretary of the DPIIT. Mr. Abhishek, many thanks for joining us. In many ways, a lot of these ideas have been tried and tested by the government. I guess at this point in time, they're putting together a comprehensive 360-degree plan to try and draw in investments, as opposed to an overarching manufacturing policy, which was the objective of the government till you were in office. It now seems to be a sector-specific approach, linking sector-specific incentives to draw in investments. Do you think that that is likely to be more effective?
Yeah, hi, Shereen. I think it's a really good idea to have an empowered group of secretaries. What happens, in specific sectors, in large investments need very different type of incentives. The incentives that are required for, let's say, mega electronics manufacturing are not necessarily the same that you need required in, let's say, defense manufacturing. So different incentives, with the empowered group, they can talk to large investors and see what they want, and they can facilitate approvals at the state level. I think that's a good idea. And sometimes a lot of incentives and approvals are at the state level. This forest and environmental clearance gets very delayed sometimes in many states. Also, sometimes the specific industries, they need different kind of incentive. For example, some investor may require that instead of buying electricity from, let's say, electricity board, they should be allowed in-house generation of green power. So I think flexibility is really the name of the game. If you want to bring in those investments, you have to be flexible. You have to push for faster time-bound approvals, and an empowered group of secretaries that is continuously monitoring such large proposals, I think can be very helpful.
Yes, an empowered group of secretaries could be helpful in being able to speed the process through. But on the idea of these industrial clusters, these industrial parks being upgraded, the plug-and-play model, which was spoken of right through 2014 onwards, finally being operationalized on the ground, what will it take, Mr. Abhishek, to ensure that it is a reality? Because, as I said, it's not a new idea.
You see, there are many industrial clusters and parks in the country which have good facilities. Even some of these industrial clusters coming up under the Delhi-Mumbai Industrial Corridor, one near Aurangabad, one near Ahmedabad. They are doing the very state-of-the-art infrastructure that is being created. I think it's really important that the different type of approvals and incentives that are comparable to those of competing countries like Vietnam and Thailand and Indonesia are offered to these investors. And state governments have seen that very keen to offer more incentives for mega investments. They are also keen to facilitate any removal of obstacles and difficulties at the local level, at the area level, industrial states. So that kind of upgradation may be required. But I think main thing is you need to bring in those investments. Industrial infrastructure is already there. It can always do with a lot of improvement, of course.
Yeah.
But I think a lot of states are very keen to do that.
Yes, states are in fact keen to do that. Mr. Abhishek, always a pleasure, sir. Appreciate you joining us here on CNBC-TV18 with your take on what the government is proposing to do, this three-pronged strategy that the DPIIT and other government officials are putting in place to try and draw in big-ticket investment as we move forward. Well, time for us to head into a break, but on the other side, a special report on the COVID-19 challenges faced by healthcare workers in Mumbai. Our colleague Archana Shukla gets you a ground report.
We're outside the Sion Hospital here in Mumbai, one of the hospitals run by the municipal corporation with over 1,600 bed capacity here. This hospital was not a designated COVID center but has been getting many COVID patients, and doctors tell us that more than 200 COVID patients are being treated here in various wards inside the Sion Hospital. Every BMC hospital has been running fever clinics, and they have a screening centers that screens all suspect cases and sends them to designated COVID wards. 200 to 250 patients here in Sion Hospital. But the trouble is not that. The trouble is that the available number of beds in this hospital have not been adequate enough to take care of the increasing burden of patients, particularly those suspect with COVID. And that's putting a lot of pressure on the healthcare workers, particularly the resident doctors who are in charge of taking care of the patients, both COVID and non-COVID. Considering Sion Hospital is here close to Dharavi and close to the highways, most resident doctors say that the inflow of patients, non-COVID patients, trauma cases is also pretty high in normal times as well. And it has gone up significantly in the last few weeks. Well, Dr. Gaurav, let me ask you first. You were at the line of duty when you got the infection. You've recovered from it. What has been the life inside a hospital like Sion Hospital, looking at the inflow of patients?
The life inside the hospital has become very different from what we are facing already. Earlier, we used to have many patients earlier too, but since the pandemic, the number of patients coming, the number of bad patients coming is increasing. These patients take a lot of time to recover, and hence we're not able to increase the turnover.
Dr. Gaurav is one of the over 100 healthcare workers in Sion Hospital who were exposed to the virus and got infected by coronavirus. 10 of them have recovered and are back serving back into their service and duty at the hospitals. The other are still in their quarantining period and are recovering from the virus. 48 of resident doctors is what they tell us. There's been an increased risk of infection to healthcare workers, particularly the doctors and the nurses who directly deal with the patients. how are you all dealing at that, with that challenge right now?
Yeah, ICMR has set certain guidelines according to which a resident doctor should do 7 days of COVID duty, then should take 7 days of rest and 7 days of non-COVID duty, and then back to COVID duty. So, according to these recommendations, the viral load and the exposure will decrease. So, we all request our authority if we can follow that recommendation, so it will be better and the exposure to a resident doctor will decrease.
So let me just put this into context. So every healthcare worker and every resident doctor that's looking at the patients is supposed to service 7 days and then take a 7 days of quarantine period and then a 7 days of non-COVID duty. That cycle, if I'm putting it correctly, helps reduce the viral load and helps to check if there are any symptoms that appear if they have been exposed and infected with the virus. Is this 7 day period being followed in the hospitals?
Currently, we were asked not to. 7 days has been reduced to 5 days in the recent light of events because the caseload has also significantly increased. And since we were facing a crunch, they have reduced it to 5 days. So we are not sure exactly how this will further cater to, demanding the situation. How will this actually help? Because 7 days has been well thought of, because it requires 7 days for you to have symptoms. And if you do have a symptom and you do if 5 days was not enough, if the 7th day you develop the symptom and you were going for the non-COVID duty, you might end up exposing more people, which is why I feel 7 days was adequate enough. Ideally, ICMR has said for 7 days. It was followed as 14 days in China, but it was reduced to 7 days because of the crunch we were facing. But now, because the caseload is increasing further, it's been reduced to 5 days.
Okay, and that you think has increased the chances and the risk factor?
Because it's just been implemented, so it might increase the chances further
of infection.
Yes.
Still the discussions are going on, whether to implement it and how many days to implement. So we are just suggesting that if those guidelines are followed, so it will be better.
It will be better.
These guidelines have come very recently. If they're implemented, it's very good. But I'll not held anyone responsible if they're not implemented. Yeah. We are short of doctors. Yes. At medicine department, many of us coming positive are already into quarantine. So at such a situation where we need skillful doctors, we just cannot appoint any other department doctor into a COVID patient duty. So in this scenario, we need skillful doctors. We need appropriate skills to treat that patient. Right. And if we lack that patient, we cannot have an immediate replacement for it. So we feel if colleges and the hospitals outside of the red zones, outside of this corona area, if they can come and help us into Sion Hospital, it will be a great help. It will maximize our output, it will maximize our efficacy, and it will help the patients.
Okay, and it'll help you all to serve better. Dr. Shefali, help us understand, considering Sion has not been converted into a designated COVID center, you also get a lot of non-COVID cases. And how are you all managing with the loads of the patients? Has it gone up? How much has it gone up? And which are the kind of cases that you're getting more? Because elective surgeries were stopped, electric OPDs have been stopped, but what is the life like in terms of a daily OPD routine and stuff?
So the reason why elective OTs and elective OPDs were stopped was to cater to COVID positive patients and SARI patients essentially. So that number actually has been replaced with the SARI patients currently, right? So we are also catering to COVID positive patients. At the same time, emergency services are still continuing over here. So if you add up both the things, we are facing the same crunch we were facing before as well. Before the pandemic started, we were facing a crunch all the time. Everybody knows about this. And even today, we face the crunch.
Doctors from different medical colleges, senior doctors or the resident doctors are being shunted to different hospitals to cater to the demand. The doctors from Sion Hospital are dealing with COVID positive patients in Seven Hills at Kasturba. At the same time, they are dealing with COVID as well as non-COVID emergencies in Sion Hospital itself. So you see the healthcare staff itself gets onto a huge crunch. Physical as well as mental stress is added.
From a doctor's perspective, someone who's looked at COVID from this close distance and experienced it yourself, where is the city right now as far as handling the COVID crisis is concerned in terms of the disease spread? Are you all seeing increased number of SARI cases and influenza-like cases? Are we going to see a burst of patients more in the coming days? And how equipped do you think the city has been in the last 2 months now?
To be very honest, we were not equipped at all. We are doing our max. I'll say the city, whatever it has done max. But we should realize whatever it has is not enough. And it is sad that it took a pandemic for us to realize this. About the patients, it is very unpredictable, but I still feel there will be an increase of number of cases. It is not going to fall down very soon, at least in Mumbai. The incidence and the prevalence of corona is directly proportional to the density of the population. In cities like Mumbai, where the population is so dense, it is very hard to see, it is very obvious that there will not be a surge, there will not be a decrease in the number of cases very soon.
So you're saying that earlier when SARI patients used to come, those with acute respiratory illness symptoms used to come.
In rainy season we used to get those.
Okay, not all were critical.
Yeah.
But now everyone with a SARI is treated as a critical patient,
yes.
And hence you have to put those resources.
And further the fear is, with the rainy season coming soon, in 1 or 2 months we'll have rains. With that, the SARI patient we used to have during the rainy seasons and the corona, if all gets together, I don't know what will happen. I'm scared.
Dr. Shifa, you were earlier pointing out to other things apart from a ventilator.
Because that's what has been said, that we've been providing more beds, we're providing more facilities for patients to be there, but we also need the equipment required to take care of the patients. It's not just a ventilator that you need a doctor to manage the ventilator. You need a monitor, 24 hours monitoring of the patient. So just a bed and a facility to provide that bed will not do. You need equipment, and that takes time. Looking at a pandemic, the scale rises up, right? The population that will get affected rises up. So what you had been preparing for earlier needs to be met more. Like, we have to meet the demands at the earliest as well.
In such a humid climate, such a hot and humid climate, wearing PPEs, you cannot work for more than 4 hours to 6 hours. 6 hours is the maximum. After that, you drench so much that you are physically tired, you're mentally tired. You see patients not recovering, sometimes you see patients dying. It is a mentally stressful situation and it takes up your energy.
In spite of doing all these things now, it is very, disheartening for all of us that they are deducting 10% of our stipend.
Your salaries are being cut, even despite stipends are being cut.
So according to Income Tax Act Section 10/16, they can't, deduct the tax from a stipend. But still, they are saying that some vendor charges are being applied.
All of you are seeing those deductions come into your stipend. Is that...
All the BMC hospitals are facing those stipend cuts because of the TDS, as opposed to the colleges like JJ Hospital, which is government-run hospitals. We need a bit more transparency into it. Yes, I am not an economic expert to say that whether it should be cut or not. But then there is a need of transparency. There is a need to go further, look into it. It's right on the part of a residents to question. After being paid 1.5 months late, we did not get our salaries for April. We got our salaries for April, in mid-May. So at the same time, facing such a crunch, all the economic activities are shut. Be it regarding a family or anyone. I'm the only earning member at present in my family. So we need to understand that with that we should not be letting our healthcare workers face an economic crunch at the same time when they're undergoing so much of physical and mental stress themselves.
People who are going home, they're scared of spreading it to their family members as well. And on top of that, you add an economic crunch on us. Is that a thing to do in this time?
At the same time, we need to start with the healthcare workers' insurance. They need to feel insured to go to work. Be it doctor, senior doctors, or a healthcare staff, anyone included.
If government gives incentives, there will be more and more private practitioners entering this. Seeing our cuts, why would a private practitioner feel safe and will be encouraged to come, will be willing to come? Why will he feel? Instead, government should give incentives.
The emotional burden, the burdens as far as economic crunch is concerned, and the feeling of demoralization when their stipends are being cut for resident doctors who actually take up most of the load in hospitals like Sion Hospital.